This is a short video about a chemotherapy combination known as Folfiri, F-O-L-F-I-R-I. This is a combination used often in the management of colorectal cancer, but also in the management of patients who have cancers of the esophagus and stomach. Folfiri is given every 2 weeks and consists of 2 drugs given intravenously. These are 5-fluorouracil and another drug called irinotecan. We usually plan for patients to have between 6 and 8 cycles before we repeat the scans to see if there's been a good response to treatment. Now, usually you go in and have the chemotherapy and it takes around 2 to 3 hours every 2 weeks. There is, however, an infuser which will be connected, and you have to come back and have that removed 48 hours later, so that's only a couple of minutes. When we give Folfiri, we're obviously concerned that, one, it's effective. We don't really know that until we've repeated the scans, but also we have to be concerned about side effects. The major side effects that we worry about are an acute side effect known as the acute cholinergic syndrome, which happens within a few hours of having irinotecan and can consist of very severe cramps in your abdomen associated with very, very profound diarrhea. And if that were to happen, we would ask you to be in touch with the hospital straight away, since you'll need to be assessed and possibly admitted to have fluids given at that stage. Other risks of the Folfiri combination are very much the same as other risks of chemotherapy. We worry about the fact that the chemotherapy can deplete your white count, so you become very susceptible to infection. We worry possibly that your hemoglobin, the red cell count, can go down, and also, though relatively rarely, that the platelet count can be too low. The other problems that patients experience with Folfiri are again diarrhea, and we're very keen that if you experience diarrhea, by that I mean both a combination of loose stools and increased frequency of opening your bowels, that you make contact with us and appropriate medication is taken if needs be. Other potential risk factors with Folfiri include hair loss, though that isn't necessarily guaranteed, and of course the general complications such as tiredness and feeling run down. Occasionally, patients develop ulcers of their mouth and possibly their back passage. In general, however, Folfiri is very well tolerated, and the side effects that patients accumulate are very much related to the chemotherapy. There are no protracted long-term side effects which give us cause for concern. As I've said, we review patients usually with every cycle, but in terms of formal imaging, usually at the end of 6 to 8 cycles. I would hope that this information goes some way to complementing the information you were given in clinic, as well as any of the written information or online information that you've been provided with. Thank you.